One of the most common reasons that patients come to see me is for rhinoplasty. That's surgery on the nose. And that's to reduce the size of the nose, to make it smaller, to improve the function of the nose as well. Fortunately, I can do it all together. So when a patient comes to my practice, they'll see my nurse first of all and have a consultation in regard to their issues and problems. And then I will examine the patient and talk to them specifically about what they don't like about their nose, whether it could be the bump on the nose, a droopy tip, a crooked nose, and I also ask them about their function. Once I've examined the nose, then we take some photographs, put them on the computer and do some digital imaging so we have communication between each other as to what I can achieve and what the patient wants. I think that's very important to have that communication. Once we've actually performed the imaging, then we can discuss the surgery. Surgery for rhinoplasty can be done either internally or externally with a small cut underneath. In my practice, 70% of the surgery I performed is via the internal approach, and I do perform the external approach usually for difficult cases being revision surgery or really crooked noses. But otherwise, with my experience, I've been able to perform most of the rhinoplasty via the internal approach. I think the advantages of the internal approach is that I can see the anatomy much clearer at the time of the surgery. There's less swelling, and I think the post-operative healing is much faster as well. I have a special technique that I use in addition to the internal approach that allows healing to be much faster. Now, patients ask me, is it painful? And generally it's not that painful because you're asleep, there's local anaesthetic on board, and when you wake up from the surgery, most people have virtually no pain. Do you get swelling? Yes, you can get a bit of swelling and bruising around the eyes, but that's usually at a maximum after 2 or 3 days, and a lot of my patients have virtually no swelling or bruising after surgery. It's a combination of the technique, the internal approach, and using fine instrumentation and knowing what I'm doing. In that post-operative period, when you're feeling at your most vulnerable, we look after you. We get you in here 2 to 3 days in the first week post-surgery. So if there's any questions, if there's any problems, any concerns, we're here for you, and that's most important. After the splint comes off, there's usually a bit of swelling, and that swelling can last for 2 to 3 weeks. But my little technique that I use inside the nose actually decreases that swelling. After 3 months, the nose is really looking great, but it's still swollen. And after 6 months, it's looking even better, but it's still swollen. And it takes 12 to 18 months to get that final result. But it's amazing the effect it has on people's personalities, even 1 month after surgery. I've had patients go out on dates and get engaged after a month. So it has a huge impact on people's lifestyle. So my philosophy and aim is to create a natural nose that complements and harmonises the natural features of your face. Everyone's nose is different, and so we have to match up your nose to your features. So with the right advice, with the right procedure, you'll have the confidence to be yourself.